Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about this topic because many people live with it quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. I want you to imagine for a moment that you and I are sitting together in a quiet exam room. The lights are soft. There is no rush. You are not in trouble, and nothing is urgent. This is simply a gentle conversation between you and a doctor who cares about how you are feeling and how your days are going. I am speaking directly to you, the same way I would speak to someone I've known for years. Many adults, especially after the age of 40 or 50, begin checking their blood pressure at home. Sometimes a doctor suggests it, sometimes a family member encourages it, and sometimes you decide on your own because you want to take care of yourself and stay independent. That desire is a very good thing. It tells me you care about your health and your future. But what many people do not realize is that blood pressure is not just a number that appears on a screen. It is a very sensitive reflection of what is happening inside your body in that exact moment. It responds to your posture, your breathing, your emotions, your muscles, and even how relaxed you feel in your chair. Because of that, the way you measure it matters just as much as the device you are using. I see many patients who come into my clinic feeling worried, confused, or discouraged because their home blood pressure readings seem to change all the time. One day the number looks fine, and the next day it looks higher. Some people start to feel anxious before they even press the button on the monitor. Others stop checking altogether because it feels stressful or overwhelming. And many people quietly wonder if they are doing something wrong, but they are too embarrassed to ask. I want you to know something important right away. You are not doing anything wrong by trying to monitor your blood pressure, and you are certainly not alone if it feels confusing. Many kind, intelligent, careful adults struggle with this, simply because no one ever sat down and explained it slowly and gently. Blood pressure is meant to be measured when your body is truly at rest. That means not just sitting down, but feeling settled. Many people are surprised to learn that even small things, like walking across the room, climbing a few steps, or having a conversation, can temporarily raise blood pressure. This does not mean something is wrong with you. It is simply how the body works. Your heart and blood vessels are constantly adjusting to support you. When you move, your heart works a little harder. When you talk, your breathing changes. When you feel worried or rushed, your nervous system becomes more alert. All of this can gently push your blood pressure higher for a short time. If you measure during that moment, the number you see may not reflect your true resting blood pressure. This is why many people find that their readings feel unpredictable. They may sit down, put on the cuff, and check right away without giving their body time to settle. The monitor still gives a number, so it feels official and trustworthy. But the body may still be in an active state. I often explain it like this. Imagine taking a photograph of a lake. If the water is calm and still, the image is clear. If the wind is blowing and the surface is rippling, the image looks very different. Your blood pressure reading is like that photograph. It depends on the moment you capture. Another thing many adults experience is checking blood pressure during emotionally busy moments. Perhaps the television is on, perhaps the news is playing in the background, perhaps you are thinking about a phone call you need to make, a bill you need to pay, or a loved one you are worried about. Even if you feel calm on the surface, your body may be responding quietly inside. Your body does not distinguish between emotional stress and physical stress very well. Both can gently raise blood pressure for a short time. This is one reason I often suggest creating a small ritual around blood pressure checks. A quiet room, a comfortable chair, a few slow breaths, not because anything is wrong, but because your body deserves that moment of calm. Many people are also surprised to learn that posture plays a role. If your feet are dangling, if your back is unsupported, or if your arm is held up by muscle effort, your body has to work harder. That effort can influence the reading. Supporting your back and resting your arm comfortably allows your muscles to relax, which helps the measurement reflect a more restful state. The position of your arm matters too. When your arm is resting comfortably at about the level of your heart, the pressure in the blood vessels is measured more accurately. If the arm is much higher or lower, gravity can subtly change the reading. This is not something to worry about, but it is helpful to understand. Another quiet influence is the need to use the bathroom. Many adults, especially as they get older, live with a full bladder more often than they realize. A full bladder can gently stimulate the nervous system and increase pressure inside the abdomen. This can raise blood pressure temporarily. Emptying your bladder before measuring can help your body relax more fully. Talking during the measurement is another very common habit. Many people chat with a spouse, talk on the phone, or respond to someone in the room. Even calm conversation uses muscles and changes breathing patterns. The blood pressure cuff is trying to detect very subtle changes in blood flow, and movement can interfere with that process. Sitting quietly without speaking often helps the reading feel more consistent. Clothing can also play a role. The cuff works best when it is placed directly on the skin of the upper arm. Fabric, even thin fabric, can interfere with how the cuff senses pressure. Rolled-up sleeves can act like a gentle band around the arm, which can change blood flow below it. Removing clothing from the upper arm before placing the cuff allows the device to do its job more accurately. Cuff size is another area where many kind, careful people are misled. Arms come in many shapes and sizes, and cuffs are designed to fit specific ranges. If a cuff is not the right size for your arm, the reading may be less reliable. This does not mean you need to feel worried or frustrated. It simply means that matching the cuff to your arm can make the information you collect more useful. Timing matters too. Blood pressure naturally follows a daily rhythm. It tends to be lower during sleep, rises in the morning, and changes throughout the day. Measuring at very different times can make readings feel inconsistent. Many people find it helpful to choose 1 or 2 calm times each day and stick with those times, so the body is being measured under similar conditions. Another gentle habit that often helps is taking more than one reading. Blood pressure can fluctuate from minute to minute. Taking a second reading after a short rest can sometimes give a clearer picture of where your body is settling. This is not about chasing numbers, it is about observing patterns calmly. Keeping a simple record can also be supportive. Writing down the date, time, and reading helps you and your healthcare providers see trends over time. It takes the pressure off trying to remember numbers and allows you to approach the information with curiosity rather than worry. I want to pause here and speak directly to your heart for a moment. If you have ever felt anxious, discouraged, or overwhelmed by blood pressure readings, please know that your feelings make sense. Many people silently carry that worry. Some fear that a higher number means something terrible is happening. Others feel frustrated when the numbers do not seem to match how they feel. Blood pressure readings are pieces of information, not judgments. They are not a reflection of your worth, your effort, or how well you are taking care of yourself. They are simply data points that help guide gentle conversations about health. I have seen many patients feel great relief when they learn that small changes in how they measure can lead to more consistent readings. Not because anything was wrong with their body, but because the body was being asked to speak in a noisy environment. Creating a calmer setting allows it to speak more clearly. One patient once told me that checking her blood pressure felt like taking a test she was afraid to fail. When we slowed down, adjusted her routine, and removed the sense of urgency, she began to see the process as a moment of self-care instead. That shift alone made a difference in how her body responded. If you are caring for a spouse, a parent, or another loved one, your calm presence matters too. Helping them sit comfortably, reminding them to rest quietly, and approaching the measurement without tension can make the experience feel safer and more supportive for both of you. It is also okay to take breaks. You do not need to measure constantly. Your body is not asking to be monitored every hour. Gentle consistency is often more helpful than frequent checking driven by worry. As we talk about all of this, you may be noticing small habits you recognize in yourself. That is not a reason to feel bad. It is simply awareness, and awareness gives you options. You can choose what feels supportive and let go of what feels stressful. I want you to stay with me a little longer because there is something deeply reassuring I want you to hear. Blood pressure is not meant to be managed alone. It is meant to be understood in partnership with a healthcare provider who sees you as a whole person, not just a number. Your home readings are one piece of that picture, and when taken calmly and thoughtfully, they can be very helpful. You are allowed to ask questions. You are allowed to say you feel confused. You are allowed to say that measuring makes you anxious. Those are not weaknesses. They are honest human experiences. As we come toward the end of our time together, I want to gently remind you that caring for your health does not have to feel frightening or overwhelming. Small, kind routines often help the body feel more comfortable and the mind feel more at ease. You deserve that sense of steadiness. If this conversation has helped you feel a little more confident or a little less alone, I would invite you to like this video so more people can find it. You may also consider subscribing to this channel if you would like more calm, supportive health guidance spoken gently and clearly. And if there is someone in your life who checks their blood pressure and often worries about it, sharing this video may help them feel understood and reassured. I also welcome you to leave a comment and share your experience, if that feels comfortable for you. This is a safe and welcoming space, and many people find comfort in knowing they are not the only ones navigating these questions. Thank you for spending this time with me. Take a slow breath. Be kind to your body today. And remember, you are doing the best you can with the information you have, and that is always enough.